what's the place called, Oakwell?
Yes.
You may have the opportunity to see some residents there that have gotten out of the hospital and they're rehabbing there. And so maybe those would be interesting residents to follow to look, because they'll have some current labs out from the hospital, you see. And maybe there's some that's had fractured hips and they're just there for 21-day stay to just because they don't have family that can take care of them. But it'd be interesting because I guarantee that they did send the latest labs from the hospital to the nursing home. And those are good to review and take your lab manual and try to understand how the different lab values make sense for that particular resident. You see what I'm saying? Why would it be significant if this person has a low albumin, a low serum albumin? Let's see now what's happened to this person. They've been living alone and they fell and they had a fractured hip and they've been in the hospital for about 3 weeks. They finally get to a point where they're able to be discharged and they get sent to the rehab part of the nursing home facility to recover before they go back home. But review their labs to try to have better understanding of what of your patient. Why is water an essential nutrient? Let's see. It's solvent. Water is the basis of the body's chemical processes. It transports substances. Notice I put the Smart Water bottle there because you guys might want to come with Smart Water on Wednesday, right? I buy that sometimes, Maybe I did that for y'all, I can't remember. It's a pretty big group. I don't know if I poured water for everyone. No, it wasn't for my mental health course. I did that one time. It was an incentive, as they were taking an exam. Body structure and form. Water fills the spaces in body tissue. Water also helps maintain the body temperature. It keeps, it resupplies us. And let me tell you, on that court, that tennis court yesterday, it was hot. And we went through all the water that we brought. Cools the body. I said, oh, heck, let me just pour the water over top of it. I was that hot. Out of shape, more like it. And interesting enough, I was thinking as I was driving to work, I said, oh, I'm going to do that lecture on nutrition. And I know I have that little slide in there about water. And as I'm getting ready to come, I have the TV on and I'm listening to CNN, I think it is. And they have Smokey Robinson. Did anybody see that? Anyway, he's joined this campaign with former President Clinton. And, he does that global initiative, right? Looks for causes to help the betterment of humans in the world. And one of the biggest needs is just to have clean drinking water. There's places that don't have it just has contaminated water. So they have teamed with Procter & Gamble to make these little packets. It costs about 2 cents a piece. And what this packet, it can be poured into a big jar, stir it, let it sit for 30 minutes, and then all they have to do is take like some sort of cheese or cloth or some sort of cloth, and they pour the water that's in the jar into another jar, that's the filter, and then that becomes clean drinking water. The little packet is the key though, getting that out. And they're starting some sort of Twitter campaign because they Twitter this like these big Hollywood magnet stars. They get on the bandwagon, and then those big Hollywood stars have fans that follow them. See, I don't know that much about this Twitter stuff, but that's how they're looking to see about possibly getting small donations to be able to make this be a global thing. the concept of clean drinking water. Such a simple concept, but many places in the world don't have clean drinking water. We're fortunate here in the United States. Kilocalories. They're tiny creatures that live in your closet and sew your clothes a little bit tighter every night. I do believe that. I
Yes.
do believe that.
I believe that too.
I'd have these clothes, and I think I finally threw away my clothes, though, that I had hoped that I would get into. One hopes you can get back into these things, right? I can keep hoping. I gotta get out on that tennis court more. In chemistry, guys, all of y'all learned this about the kilocalories, how they relate. Carbs have 4, proteins have 4, and fats have 9. Y'all remember that, don't you?
A little bit.
Y'all remember, that's old stuff.
Reading the book.
But it's in your book, and why is it in your book? Because probably someone in here is going to have an NCLEX board question that's going to say you have this many grams of carbs and this many grams of protein, this many grams of fat. What are the total kilocalories is this patient taking in? Can you see that as, I can see that as an NCLEX question, tied into nutrition. See? So that's why I said, no, better tell you about that, because that's a possibility, right? And that's a simple math problem. Y'all get that, right? You want to be able to always get any of your math calculations on your state boards right. That's a no-brainer, because you know you got that right. There's no excuse for you not to be able to calculate all your drug doses calculations and your IV calculations. I think that's what it was too. It made me think, I better make sure y'all know how to calculate these IV drips. I got a simple way of teaching you. If someone teaches you different and you want to take their way, then that's fine. Mm-hmm. At least I'm giving you knowledge. That sounds fair, right? Mm-hmm. Okay. Basal metabolic rate. Measure of the energy used while at rest in a neutral temperature environment. It's a balance. It keeps our bodily functions in check. A BMR. You guys might have to do some calculations. You guys definitely could have some state board questions that just want you to identify some of these anthropometric measurement devices. You won't have to necessarily describe how to utilize them, I don't think, but you may have to calculate body mass index. That's a very big possibility that they would have you do that. And I might have you do that on the final exam. I don't think I have it for Wednesdays, but the final exam I might throw one question out there on calculating BMI, and that's in your textbook. If you go, you can go to your textbook, 26.2 and 26.3.
Are you writing final or is it
Are we going to split? It's going to be a split.
Goodness.
Can you write both?
No,
Uh,
I can only do my part.
You write it.
We have parts. We have parts. Let's move on and talk about factors that affect nutrition. Oh, no, we don't have stress because you'll be immune to anything, any crisis that hits you by the time you get done with nursing school, right? You'll be able to handle it. We're just trying to help you. Factors that affect nutrition. Well, we know from infants to 1 year, that's the period of most rapid growth. You guys are going to learn more about that when you go to the maternal child. I'm just giving a little brief brush of it.
The book has how to calculate BMR.
Yes. Yes.
Oh, I thought you said BMR.
no, at the
It
bottom
has-
too,
it
she
has
has
both,
BMI
I
too.
think.
Yeah, she's talking about BMI too on the final.
Yes. We'll look at that. You guys can go to your volume 2. It's going to help you learn how to do it. Birth weight doubles
She got another.
within that first 5 months. Who's had baby here? So you know what I'm talking about, how small the baby is when they're born. And then about 5 months, you can barely carry them, right? You start having to daddy. Here, you do it. Heavy. Nutritional needs are greater here because why? They're doubling their size. Guys, remember this, and this will be on state boards. Breast milk, commercially iron fortified formulas. Those are the only thing that you should be providing your infant those first at least 6 months, and dare I say, some say a year. And some even say, oh, breast milk is the way to go. See, but no, not for me. I didn't have time.
Yeah.
I didn't have time for that. But commercially iron fortified provides this is good. But the breast milk, they say, you know, helps with that infant's immune system. But one thing you never want to do is give your infant any cow's milk. That first year it's a no-no. That first year it's a no-no. It's too taxing on their system. Their system hasn't developed. Another thing is no corn syrup, no honey. I was trying to find something no honey can put across a honey jar, but the best I could find is no money, no honey. But no corn syrup, no honey. Because what they find is they have spores within the honey, and that can lead to botulism, which will be fatal. So no honey, no corn syrup. And that's best I could come up with. No money, no honey. Solid foods at 4 to 6 months. I was that one that started at 4 months. Believe me, I was working those 12-hour ICU shifts, and he had to sleep, and I needed to sleep. So I was slipping that stuff in the bottle. Probably too soon, but I did. And now I hear, which is a little known fact or unknown fact that rice cereals have a certain microscopic amount of cyanide in it. I saw that on the news.
Yeah, and arsenic.
Arsenic, that's what.
They're saying, yeah.
And that's the first thing they want you to give your baby. Why they want you to give your baby rice cereal?
Yeah. I know.
That's the first thing they say
And I
starves
said,
them
oh, well, it's too late now. I've already created the PowerPoint.
You're also not supposed to put cereal in their bottles. That's
Yeah.
like a major no-no.
Well, I did all that.
Yeah, I did too.
I did it. I did it. Guilty.
So you supposed to put in the bowl.
But now, they said, well, if you wash and even the concept of rice, what should you be doing? It says, wash your rice. See, I've never done that. I just bought the bag of rice or the box of rice, but see, but things you can learn on TV, right?
How could you wash it? Wash that?
Wash it with water. Just run it in a colander.
Oh, you're talking about regular rice?
Yeah,
Oh, okay.
even regular rice,
Yeah.
because you can buy these cheap brand rices in these bags,
You talking about cereal.
or sometimes you can buy them by the bulk, like you go to Costco, you can get like 50 pounds of rice, you buy that kind of, if you use that much rice, But they said, you should be rinsing your rice through a colander before you cook it. Okay, so by 1 year of age, we should be able to eat some table food, but keep in mind that sometimes these may trigger food allergies. Just always be aware. And toddlers and preschoolers, they're picky eaters. So you got to figure out ways to make the food fun and fun to eat. Be careful with the hot dog. That'll be an NCLEX question. Somebody's going to get that, the toddler that has the concern about hot dog is choking, right? That's what'll happen. They'll swallow the hot dog before it happens, so you must cut in small pieces, right? Preschoolers, they just don't like vegetables. They drink less milk. They're not gonna like casseroles, because that sounds like old people's food. You gotta make food fun. So hence I found that. See how much fun that looks? See? I said, well, let me give this is a good idea for my students, because, you know, you got young kids, and maybe if you fix up the watermelon that way, it makes it intriguing that they put their hands in the mouth of Jaws and they're, see? That looks fun. You guys can take that. Try it and see if you have better success at your children. Fruits and vegetables. Maybe we can stick some vegetables in there too. The pregnant lactating women. Folic acid, that's the one that's going to fall out really big time. On state board, someone's going to have that. Remember that they need to have a supply of folic acid because it can lead to some defects, i.e. something to do with spina bifida, these neurotube defects. Protein and calcium, because why? You're not supplying for your own muscle and bone growth. You're supplying for the infant to be, and iron, of course. Then there's lifestyle choices, vegetarian, and I will tell you, I've had students who have this one a lot on state boards, this ovo lacto vegetarian, to understand the difference between these types of special diets. But that one I have had students come back and say they've had that particular question on ovo lacto vegetarians. But any of those I guess you could have, but that's what the students told me about. The ethnic, culture, religious practice. There's certain foods that certain religions bar against. Certain rituals. Kosher diet, they prohibit the pork. No pigs. And then there's special diets, and this is going to more pertain to you guys when you're in the hospital. When you're in the hospital and you have specific diets that the doctor has ordered, maybe prior to surgery. You know, NPO is nothing by mouth. It's usually NPO after midnight or 8 hours prior to a procedure. Regular diet is whatever the food is that's served. It's no special diet to it. Clear liquids. That's after they've had surgery and they're trying to wake up the bowel again. They usually start them off with clear liquids, and then they advance them to full liquids. Mechanical saw. Some of you guys in the nursing home, you already have seen a puree diet because you did assist feeds, didn't you? Puree diet for some. Food diaries, that's something I should keep, shouldn't I? But the doctors will actually have the nurses do sometimes is what they call a calorie count, and a 3-day calorie count. But also it works for patients that are, you know, the doctors wanting to follow their nutritional status. Food diary. Probably someone's going to have something about that on state boards, the importance of food diary, because it does help clue into some poor habits. BMI. See, I told you it was on the, it's in your textbook. If we get a chance, or today maybe we'll actually practice this. But I think we'll be so busy with their IB calculations. But if we do get a chance, then y'all break up in your think tank groups, and I would like y'all to each calculate your own BMI. That sound fair? Y'all turn to that page 626. There's different ways. I gave you different examples there of how to calculate it. Y'all can write one of those down if you want. One of them might be in your textbook, I don't know. how to weigh an individual. You should weigh people the same time each day, each morning, when they get up in the same outfit. My husband's father has a real bad heart problem. And the doctor has him at age 81 on lots of medications. And one of the medications he has him on is a diuretic Lasix. And he wrote him a specific order that he needed, and I had to create him a little booklet, table, so he could keep track of this. But he has him, if his weight in 3 days goes up by 5 pounds, he's to stop taking these Lasix for 2 days and then resume after that. But you see how for an 81-year-old that could get quite confusing, couldn't it? So I told him, I said, so I created a whole chart that gave, I said, okay, so you take your vital signs, and when you get up out of bed, because when he, guys, my husband's not, he's sort of bachelor-like. He's not married right now, and so he sleeps in his underwear, right? That's what goes on. So I said, well, when you get up, go to the restroom, do your thing, and then step on that scale every morning and take that weight. And that's the habit. And that's how you should do it. You should follow a pattern. And in the hospital, they usually have the night shift to do the daily weights of the patients. Now, this is one I will tell you, I have never seen this in my whole time being a nurse, this water weight. But this is a mechanism that do accurate weighing underwater, and I suppose this could be useful for maybe an individual that is so obese that they don't have a scale that can match it, but therefore and of course they have to bathe them. See, or maybe they're doing physical therapy with these individuals, and they could actually obtain a very reliable weight. But I've never seen one of these devices. I would dare say where you'd see one of these as maybe a rehab center, Laurel Ridge maybe, something like that. Signs of severe malnutrition. We talked a little bit about malnutrition and the importance of some of our lab values as it relates to malnutrition. What happens when you have an individual that's got severe malnutrition? You'll see some specific labs. The albumin level, the protein levels, they will be below normal significantly. And what you find is because albumin is that substance in our body that maintains that onychotic pressure. It keeps the fluid in the vascular spaces. But when we don't have the albumin, it seeps out into our interstitial tissues. And I don't know if anyone has anyone had a very, very ill relative that you went and visited and you noticed that they had tissue weeping and they had swelling, they had edema to their extremities. Some of y'all know what I'm talking about. Some of you's going to see it in the hospital. But those are instances of where the albumin level is quite low. Malnutrition can occur in individuals who's had severe nausea, vomiting. A frail person that goes through 3 days of that, that's deadly, because what does that do? It messes up the serum electrolytes in the body. Can cause them to have a heart attack or throw them into a lethal arrhythmia, because when you have such an imbalance of your fluid electrolytes, it causes irritability to the heart. individuals that are NPO, nothing by mouth, they come in full arrest. They put them on a ventilator and then they don't feed them for 3 days. But sometimes that wisdom is faulty. They've actually said they want to get the gut, they want to start feeding them pretty much as soon as possible, drop a feeding tube, even that same day, and start feeding them by that evening, or maybe within the next day, 24 hours after being put on a ventilator and come in for rest. Because what they found is if we don't do that, we actually arrest the gut. In other words, it stops functioning. They want to start them feeding because nutrition is always in, because granted, a person that's that sick that comes in code 3, do you think that they've been up cooking their meal and sitting and eating food? No, they haven't. They're just, they're on the verge of arresting and they come in code 3, they've not been eating anyway. These individuals that like to lose weight, Karen Carpenter, poster child for anorexia. She died she was anorexic. Some of you guys know who I'm talking about, and I think we had this conversation, Charles and my group. There's some of us, Linda remembers Karen Carpenter, singer, right? But it started the discussion rolling about anorexia, really, she was. And some of these movie stars of late, I associate as movie stars, but really people in the community. We don't know your next door neighbor could be having an issue with anorexia. We don't know, or in your family. It's very trying. It's very trying. It's a very stressful experience because it's not just the person living it; it's whole family living it. But what they, in essence, and what she did, that Karen Carpenter, she in essence had a heart attack. Her electrolytes were so bad, her serum potassium was so low, she caused herself to go in cardiac arrest. Okay. Do y'all need a break? Are we tired? Okay, let's take us a 10-minute break and we'll watch the videos. Is everybody clear with that clock? It's 9:15. We use that on the wall, so everybody be back in the seat at 9:25.